In this video, we're going to look at some miscellaneous structures that maybe weren't covered in the previous videos. First of all, I want to talk about the major blood vessels that are entering and exiting the heart. The right atrium collects blood from the superior vena cava, which in and of itself collects blood from the head, upper appendages, and upper torso of the body. It collects blood from these two vessels here, which are referred to as brachiocephalic veins. Here's the left brachiocephalic vein, and here's the right. Do want to mention the color scheme we're seeing here. You see blue blood vessels and red blood vessels. These are indicating the oxygenation level of the blood itself. You do not have blue blood. The blood is all some form of red, but it changes. The hemoglobin in blood will change color when it's oxygenated and become a very bright candy apple red. If the blood is oxygen poor, it looks more like a brick red or maroon color, and they designate this as a blue color in these models. So the right and left brachiocephalic veins drain into the superior vena cava, into the right atrium. Underneath here, we see the inferior vena cava that brings blood up to the right atrium from the lower torso and legs. So that blood comes into here. When the right ventricle contracts, we see the pulmonary trunk collecting that blood, sending blood out to the lungs through the left pulmonary artery and right pulmonary artery, which you see tucking under the aorta here. And on this model, that vessel comes out here. So that is the right pulmonary artery. That blood goes out to the lungs, comes back through pulmonary veins. Here are the two right pulmonary veins. It will take blood, oxygen-rich blood, to the left atrium. This chamber here, you look way back in there and you can see the openings to those right pulmonary veins. And even though the blood is red here, they are veins. They're carrying blood back to the heart. We also see the left pulmonary veins here. Oxygen-rich blood comes in the left side of the heart. When the left ventricle contracts, it pumps blood up through the aorta. Here's the ascending aorta, the aortic arch, and then a thoracic aorta that comes down here that would eventually continue down past the diaphragm and become the abdominal aorta. A couple more notes on vessels. The aorta gives blood to pretty much the entire body, and we start to see branches coming off here. This is the brachiocephalic artery, left common carotid artery, left subclavian artery. The brachiocephalic artery immediately splits into a right common carotid artery that goes up the neck and a right subclavian artery that goes out to the right arm. Just a little bit of slight difference there in anatomy between those three. So you have the brachiocephalic artery, left common carotid artery that goes up the left side of the neck, and the left subclavian artery that goes out to the left arm. Last thing to mention with these large vessels is this little guy back here in the back of the superior vena cava. This is the azygos vein, which is part of an azygos system which drains the posterior torso. We'll look at that in wire model videos if we can get to those eventually. But that's the azygos vein there.